Okay, we're gonna do an intramuscular injection. First, we're gonna identify some sites that we can give the intramuscular injection. So we're gonna use this for demonstration. So for the deltoid, we find the acromion process, which we're talking about the bony part right here on our shoulder, outside of our shoulder. I have the patient to relax their arm. You can do 2 to 3 fingers. We're gonna do 2 down from the acromion process. And then we're gonna take that third one and open it to a V. And that lets us know that that's our safe spot to give our deltoid. And then for our ventral gluteal, we're talking about the greater trochanter, so we're talking about this area here. So we put our palm of our hand on the greater trochanter. In this instance, my patient is facing that way, so this pointer finger would come towards the iliac crest. This finger goes towards the iliac spine. When we do that, that lets us know that that V right there, that's our safe spot. And then for our vastus lateralis, that's the lateral part of our thigh. And so then we're going to find the bottom of the greater trochanter here, and then we're going to find above our knee here on the lateral side, and into each other, and then we know that that's our safe spot for that. Okay, well, we have our patient that needs their intramuscular injection. So the first thing we're going to do is check our physician's order against the MAR, identify the patient, and go ahead and wash our hands, put on our gloves, form a focused assessment depending on what medication the patient's getting on, how we do that. So put on our gloves because we've washed our hands, all that. Okay, now that we're here, we are in the room. So if we were not inside the room and we were preparing this outside of the room, we would label our syringe before we came in. We're in the room, so we're at beside the patient and we're checking our medicine again on the MAR, the physician's order against the MAR, making sure we have the right medicine, making sure that our medicine is in date. I was checking that our medicine looks good. And then I would go ahead and explain to my patient what we're going to do, you know, what's about to take place and why. What I'm giving, and then I would go ahead and prepare this. So, go ahead and clean the top. So there would be a top on this. We'll pop that top and clean this out with our alcohol prep pad. Discard that. Now we're going to get out our syringe. This is a syringe with our draw-up needle. We pull up the air for the amount that we're going to give, which we're going to say 1 ml. This medication is what we're given. So pull up 1 ml of air. Go ahead and insert it in the vial. Put the air in and making sure when we do this that we don't have any air bubbles out. Recap safely because we've got to change this this needle. So we'll put this in the jars. Open up our new needle, the one that we're going to actually give the injection with. Be careful not to contaminate the hub. And connect it. Make sure that it's on securely. In there. Okay, now we're going to check once more at the bedside here and make sure that we do have the right medication, the right amount against the MAR and the physician's order there. Okay, and we do. So for this patient, we've already explained to them, hey, we're going to do this intramuscular injection, and we're going to do the Z-track method. So what we're going to do, located our spot, is clean this area with the alcohol in a circular motion. And then we allow that to dry completely before we inject. So make sure there's no air bubbles. Go ahead and pull our cap off. And then we're going to push the skin over for the Z-track method. We're going to inject at 90 degrees. We're going to aspirate, make sure that we don't see any blood. If we don't, we're going to go ahead and give this over 10 seconds because it is 1 ml. We're done. We're going to hold it there for 10 seconds. And we're going to come out. We would not recap this needle. We would discard of it in the sharps. Go ahead and hold an alcohol pad for just a few seconds on where we gave the injection site. We're done. So we would take off our gloves, wash our hands, and done.